Hey there! Today, we'll cover critical information about anxiety to give you a clear picture of what it's all about. First, we'll define anxiety and how it's different from anxiety disorders. We'll break it down so you can easily understand the distinction. Next, we'll walk you through the common symptoms of anxiety. It's essential to be able to recognize these signs, as they can vary from person to person. By knowing what to look for, you'll be better equipped to understand what someone with anxiety might be going through. We'll also discuss the prevalence of anxiety in the United States. It's surprising how many people are affected by anxiety, and we'll give you some eye-opening statistics to shed light on the scale of the issue. Now, let's talk about how anxiety is diagnosed and treated. We'll explain the standard procedures that healthcare professionals follow to identify and address anxiety. You'll gain insights into the different treatment options available, so you'll better understand what to expect if you or someone you know seeks help. Lastly, we'll share some valuable strategies for family members to support individuals dealing with anxiety disorders. It can be tough to know how to help, but we've got some practical tips and guidance that can make a real difference in their lives. By the end of this video, you'll have a solid grasp of anxiety, its differences from anxiety disorders, common symptoms, prevalence, diagnosis, treatment, and ways to support loved ones. What is anxiety? Anxiety is a psychological state characterized by enduring emotions of fear, concern, and uneasiness. It's entirely normal for people to experience occasional feelings of anxiety. This emotion often arises when you anticipate a potentially harmful situation. It's common to feel worried and take preventive measures to avoid any potential harm. For instance, feeling anxious before public speaking, during job interviews, when meeting new people, or while driving on a freeway is something many individuals go through. Mild anxiety can actually be beneficial as it heightens your awareness of your surroundings. This increased alertness can enhance your performance and abilities in various situations. Temporary anxiety serves as motivation and helps you confront and overcome stressful circumstances. Anxiety can manifest in different degrees, ranging from mild to moderate, severe, and even panic. Each level presents its unique characteristics and intensity. Anxiety can manifest in individuals for many reasons, as various aspects of life can trigger it. Concerns regarding financial matters, such as job security or mounting debt, can contribute to feelings of anxiety. Similarly, worries about one's health, whether physical ailments or the fear of developing a severe illness, can also be a source of anxiety. Personal relationships, including difficulties with family members, friends, or romantic partners, can generate significant emotional distress and contribute to heightened anxiety levels. How common is excessive anxiety? When fear, worry, or nervousness surpasses a manageable level and begins to interfere with daily functioning and overall well-being, it may indicate the presence of an anxiety disorder. These disorders are pervasive in the United States and are recognized as some of the most common mental health conditions. Research estimates that approximately 1/3 of adults will experience episodes of excessive anxiety at some point in their lives, underscoring the significance of this issue. Notably, women are disproportionately affected by anxiety disorders, with twice the likelihood of being impacted compared to men. This gender disparity highlights the importance of considering unique biological, psychological, and sociocultural factors that may contribute to women's development and manifestation of anxiety. Moreover, the impact of anxiety disorders extends to a significant portion of the American population, with an estimated 40 million individuals affected each year. The sheer magnitude of this number emphasizes the need for increased awareness, access to resources, and appropriate support systems to address the challenges faced by those with anxiety disorders. Recognizing that anxiety disorders can affect individuals of all age groups is crucial. While commonly associated with adults, these conditions can also manifest in younger individuals, including teenagers and children as young as 6. Early identification and intervention are vital to support their emotional well-being and provide them with the necessary tools to manage their anxiety as they navigate through various stages of life. What are the signs and symptoms of anxiety? By understanding the wide range of factors that can contribute to anxiety, acknowledging the prevalence and impact of anxiety disorders in society, and recognizing that anxiety can affect individuals of all ages, we can foster a more compassionate and informed approach to addressing this significant mental health concern. Anxiety disorders often present a range of signs and symptoms that can vary from person to person. These manifestations provide insight into the unique ways anxiety affects individuals. Some common indicators of anxiety disorders include tremors, where involuntary shaking or trembling of the body may occur. Excessive sweating is another physical response that can accompany anxiety, leading to noticeable perspiration. Anxiety can also influence the cardiovascular system, leading to a rapid heartbeat and palpitations. Individuals may become acutely aware of their heartbeats, which can feel irregular or pounding. Difficulties with sleep are also commonly associated with anxiety disorders, with individuals experiencing trouble falling asleep, staying asleep, or having restless, fragmented sleep patterns. As a result, feelings of fatigue and exhaustion can further contribute to the overall burden of anxiety. One hallmark of anxiety disorders is the constant struggle to relax. Individuals may find it challenging to unwind and experience a persistent sense of restlessness or inattention that feels difficult to shake official. Alongside this, a sensation of pressure in the chest can manifest, leading to feelings of discomfort or tightness. Psychologically, anxiety disorders can bring about a range of distressing emotions. Feelings of dread and impending doom can linger, creating a constant backdrop of fear and worry. Fear of losing control over oneself or the situation may intensify the anxiety further. These psychological aspects can also manifest in physical ways, such as experiencing nausea or a sense of dizziness. Another common symptom of anxiety disorders is shortness of breath or a feeling of breathlessness. Individuals may describe a sensation of not being able to breathe enough air, leading to shallow or rapid breathing patterns. This can contribute to a sense of discomfort and heightened anxiety. These are just a few of the typical manifestations associated with anxiety disorders. It's important to remember that each person's experience with anxiety can be unique, and not all symptoms may be present in every individual. Consulting with a healthcare professional is recommended for a comprehensive evaluation and personalized guidance. What are anxiety disorders? For individuals with anxiety disorders, the level of worrying they experience can be significantly heightened, making it challenging to control. Moreover, this worrying often occurs even when no apparent or specific danger is present. There are several types of anxiety disorders that, if left untreated, can worsen and disrupt an individual's daily life. These disorders manifest in different ways and can significantly impact a person's well-being. In our upcoming videos, we will explore various anxiety disorders in detail, but for now, let's provide an overview of some common examples. One type is a separation anxiety disorder, which typically begins in childhood and involves excessive fear or anxiety when separated from loved ones or familiar environments. This can result in significant distress and difficulty in carrying out regular activities. Selective mutism is another anxiety disorder where individuals have difficulty speaking in specific social situations, despite being able to communicate in other contexts. This can hinder their interactions and educational progress, causing significant challenges. Specific phobias are intense fears and avoidance of particular objects or situations, such as heights, spiders, or flying. These fears can be disproportionate to the actual threat. Still, they can significantly impact an individual's life and lead to avoidance behaviors. Social anxiety disorder, also known as social phobia, is characterized by a severe fear of social situations and scrutiny from others. People with this disorder may experience extreme self-consciousness, leading to avoidance of social interactions and difficulties in various areas of life. Panic disorder involves recurrent, unexpected panic attacks and sudden surges of intense fear accompanied by physical symptoms. These attacks can be debilitating and cause individuals to worry constantly about future episodes. Generalized anxiety disorder is marked by excessive and persistent worry about everyday concerns. People with generalized anxiety disorder find it challenging to control their worry, which can significantly impact their overall well-being. Substance/medication-induced anxiety disorder refers to anxiety symptoms triggered by substance use, withdrawal, or as a side effect of certain medications. It's essential to consider the role of substances and medications in contributing to anxiety symptoms. Additionally, anxiety disorder due to another medical condition occurs when an underlying medical issue directly causes anxiety symptoms. Treating the underlying condition is crucial for effectively managing the associated anxiety symptoms. While we'll explore these anxiety disorders in more detail in the future, understanding their variety helps us appreciate the complexities of anxiety-related challenges. Increasing awareness and knowledge about these disorders can create a more supportive and inclusive environment for individuals dealing with anxiety. What are the risk factors of anxiety? Anxiety can stem from different causes and risk factors that shape our experiences and influence our mental well-being. Let's dive into some of these factors and how they can contribute to the development of anxiety. One significant influence is our environment, especially our childhood experiences. Certain stressful situations, like losing a loved one, abuse, or dealing with a serious illness, can make us feel incredibly uncomfortable or nervous. These experiences can leave a lasting impact and shape our perception of safety, potentially triggering anxiety in various situations later in life. Another factor to consider is the influence of hormonal changes, especially in women. Ladies, you might have noticed that your anxiety levels fluctuate throughout your menstrual cycle. Those hormonal ups and downs can play a role in mood regulation and make you more vulnerable to experiencing anxiety symptoms during certain times. Recognizing these hormonal connections and how they can affect our mental well-being is essential. Additionally, our family history can impact our predisposition to anxiety. If you come from a family with a history of mental disorders, including anxiety disorders, you may have a higher likelihood of experiencing anxiety yourself. While genes alone don't determine everything, they can contribute to our vulnerability and influence the development of anxiety-related conditions. It's crucial to remember that these causes and risk factors don't work in isolation. They interact and intertwine, creating a complex web of influences on our mental health. For example, a combination of genetic predisposition and adverse childhood experiences can significantly increase the risk of developing an anxiety disorder. Similarly, Hormonal changes during your menstrual cycle can interact with environmental stressors, potentially exacerbating anxiety symptoms. By understanding these underlying factors, we gain valuable insights into the complexities of anxiety and how it manifests in our lives. It helps us tailor prevention efforts, intervene early, and develop effective treatment strategies. A holistic approach considering the interplay of biology, environment, and genetics is vital to providing comprehensive support for individuals facing anxiety-related challenges. Everyone's journey with anxiety is unique, and it's important to seek professional help and support if you or someone you know is struggling. What factors can worsen anxiety? Several instances and factors can exacerbate or worsen anxiety symptoms. Let's take a closer look at some of these situations and influences. Firstly, certain medical conditions can contribute to the worsening of anxiety. For example, individuals with underlying health issues like irregular heartbeats or thyroid problems may experience heightened anxiety levels. The physical symptoms associated with these conditions, such as palpitations or fluctuations in hormone levels, can create additional stress and trigger anxiety responses. In addition to medical conditions, lifestyle choices and substance use can also play a role in increasing anxiety. Consuming beverages containing caffeine, such as coffee, tea, or energy drinks, can stimulate the nervous system and lead to heightened anxiety or nervousness. Caffeine acts as a stimulant, increasing heart rate, triggering restlessness, and exacerbating anxiety symptoms. Moreover, certain medications and substances may contribute to increased anxiety levels. Some prescription medications, over-the-counter drugs, or recreational substances can have side effects, including heightened anxiety or nervousness. It's essential to be aware of the potential impacts of these substances and discuss any concerns or experiences with your healthcare provider. Furthermore, stresses in our daily lives can also worsen anxiety symptoms. High levels of chronic stress, such as work pressures, financial difficulties, relationship conflicts, or significant life changes, can create an overwhelming sense of worry and anxiety. These stresses can further intensify existing anxiety or trigger the onset of anxiety symptoms. Knowing when to seek help for anxiety is crucial for your well-being. Suppose your anxiety is consistently elevated or excessive, significantly disrupting your day-to-day life. In that case, contacting a healthcare professional for support is essential. Seeking help becomes necessary when your anxiety interferes with your normal functioning. This can manifest in various ways, such as struggling to concentrate, experiencing impaired decision-making, or having a decreased sense of productivity. When anxiety prevents you from fulfilling your responsibilities at school, work, or within your family, it indicates that seeking professional assistance is essential. Moreover, suppose your anxiety causes distressing emotions and physical symptoms that affect your overall well-being. In that case, it's crucial to reach out for help. Physical manifestations of anxiety should not be ignored. These symptoms may suggest a more severe anxiety condition that requires proper evaluation and treatment. What is the usual process for diagnosing anxiety disorders and other mental health conditions? Diagnosing psychiatric and mental health disorders, such as anxiety disorders, involves a comprehensive evaluation process conducted by your healthcare provider. During this assessment, they will gather information about various aspects of your life through interviews and questions. Your healthcare provider will inquire about critical events leading to your visit, including any significant triggers or stressors. They will also ask about your specific signs and symptoms, medical history, previous psychiatric conditions, past treatments and medication history. Additionally, they will explore any significant events or experiences from your past and inquire about your family history of mental health issues. Your healthcare provider may ask about your social history to gain a broader understanding of your situation. This may involve questions about your living situation, educational background, employment status, coping mechanisms, eating habits, and recreational activities. Depending on the circumstances, involving family members during the interview may be necessary or permitted to gather more insights into your condition. A physical examination and other laboratory and diagnostic tests may be conducted as part of the diagnostic process. These tests aim to rule out any underlying health conditions that could contribute to your anxiety disorder symptoms. Your healthcare provider must address your medical and behavioral needs, if any, to ensure comprehensive care. During your visit, a mental status examination will also be performed. This assessment focuses on observing and documenting your behavioral presentation and overall mental state at the healthcare facility. This information provides valuable insights into your condition and helps guide the diagnostic process. Collaboration among various healthcare professionals is standard when diagnosing and managing anxiety disorders. This may involve your primary care provider, psychiatric mental health nurse practitioner, psychiatrist, psychologist, social worker, or counselor. Their combined expertise and perspectives ensure that your treatment goals and objectives are met effectively. By conducting a thorough evaluation and involving a multidisciplinary team, your healthcare provider aims to accurately diagnose your anxiety disorder and develop an appropriate treatment plan tailored to your needs. This comprehensive approach ensures that all relevant aspects of your physical and mental well-being are considered to support your journey toward improved mental health. Sometimes, trusted family members may be asked to participate in your care. Their involvement can provide you with additional support and help enhance your overall treatment outcomes. What are the available treatment options for individuals with anxiety disorders? Typically, anxiety disorders are addressed through a combination of psychotherapy and medication. However, the specific approach may vary depending on individual needs. Psychotherapy, also known as talk therapy, is essential to anxiety treatment. One commonly used form of psychotherapy for anxiety disorders is cognitive behavioral therapy. Cognitive behavioral therapy focuses on identifying and challenging negative thought patterns and behaviors contributing to anxiety. People can gradually reduce their anxiety levels by replacing them with healthier and more adaptive ways of thinking and responding. Regarding medications, several types may be prescribed to help manage anxiety. These can include selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, benzodiazepines, and others. These medications target the brain's chemical imbalances associated with anxiety and can relieve symptoms. It's important to note that a qualified healthcare professional should always prescribe and monitor medication. In addition to psychotherapy and medication, joining support groups can benefit individuals with anxiety. These groups provide a safe and understanding environment where individuals can share their experiences, learn from others, and receive valuable support. Connecting with people who have similar struggles can help individuals feel less alone and provide a sense of belonging. Implementing stress management techniques is another crucial aspect of anxiety treatment. Regular physical exercises, such as walking, jogging, or yoga, can help reduce anxiety by releasing endorphins, which are hormones that help relieve stress and promote well-being. Mindfulness and meditation are also effective tools for calming the mind, increasing self-awareness, and reducing anxiety. Furthermore, a healthy lifestyle with proper sleep, balanced nutrition, and minimizing alcohol and caffeine consumption can significantly contribute to anxiety management. It's important to remember that every individual is unique, and a qualified mental health professional will determine the most appropriate treatment regimen for anxiety. They will consider factors such as the severity of symptoms, personal preference, and any co-occurring conditions to develop a personalized treatment plan. By seeking appropriate treatment and support, individuals can effectively manage their anxiety and improve their overall quality of life. It's a journey that may require patience and persistence. Still, with the right tools and guidance, individuals can regain control and experience a greater sense of well-being. Are there any other mental or behavioral conditions associated with anxiety disorders? Individuals who struggle with anxiety disorders are not only confronted with the challenges posed by anxiety, but also face an increased vulnerability to other mental health issues. It is important to know that depression, eating disorders, sleeping problems, and substance abuse often coexist with anxiety disorders. Depression frequently accompanies anxiety disorders, as these conditions share common underlying factors and can mutually intensify one another. The persistent sadness, hopelessness, and loss of interest or pleasure associated with depression can significantly contribute to the severity of anxiety symptoms. Addressing anxiety and depression concurrently is essential for achieving optimal mental well-being and enhancing the effectiveness of treatment approaches. Eating disorders, such as anorexia nervosa, bulimia nervosa, or binge eating disorder, often co-occur with anxiety disorders. These conditions involve distorted body image, unhealthy eating habits, and an intense preoccupation with food. The detrimental impact of these eating disorders on overall well-being is significant. Treating anxiety and eating disorders simultaneously is crucial to fostering a healthy relationship with food, improving body image, and promoting holistic recovery. Sleep disturbances, including insomnia or disrupted sleep patterns, frequently accompany anxiety disorders. The persistent worry and racing thoughts associated with anxiety can make it challenging to fall asleep, stay asleep, or experience restful sleep. Addressing anxiety and sleep problems is vital for restoring healthy sleep patterns and improving overall mental and physical well-being. Substance abuse or dependence can also coexist with anxiety disorders, as individuals may use alcohol, drugs, or other substances to cope with anxiety symptoms. However, relying on substances as a temporary relief can exacerbate anxiety symptoms and lead to a destructive cycle of dependence and deteriorating mental health. Seeking professional help for anxiety and substance abuse is crucial for breaking free from this destructive cycle and developing healthier coping mechanisms. By having open and honest conversations about these additional health concerns with your healthcare provider, you enable them to create a comprehensive treatment plan that considers all aspects of your well-being. They can assess the severity and interplay of each condition, identify any underlying connections, and make informed decisions regarding the most appropriate interventions and therapies. Remember, reaching out for help is a courageous step towards enhancing your well-being. Addressing the co-occurring conditions alongside your anxiety disorder increases the likelihood of achieving lasting recovery and finding greater balance in your life. Your healthcare provider supports you throughout this process, ensuring that the best decisions are made to guide you on your unique journey toward healing. What are some ways to provide support to someone who is displaying excessive anxiety? When it comes to supporting a loved one who is facing overwhelming anxiety, you can provide valuable assistance in several ways. If you have a family member or friend who has been diagnosed with an anxiety disorder or is displaying signs of anxiety, it's important to offer your support in a caring and understanding manner. Here are some practical steps you can take to help them navigate their anxiety journey. 1. Show empathy and understanding. Approach your loved one with empathy and try to understand their experience. Recognize that anxiety can be debilitating and validate their feelings without judgment or criticism. Let them know you are there for them and genuinely care about their well-being. 2. Create a safe and predictable environment. Avoid surprising or catching them off guard, which can trigger heightened anxiety. Instead, strive to create a predictable and structured environment that provides a sense of stability and security. Consistency and routine can help alleviate anxiety symptoms. 3. Stay calm and composed. During moments of anxiety or panic, you must remain calm and composed. Panicking alongside them may escalate their distress. Speak to them calmly and soothingly, providing reassurance that you are there to support them through their anxious moments. 4. Foster open communication. Encourage open and honest communication with your loved one. Be a good listener and allow them to express their thoughts and feelings without interruption. Avoid dismissing or trivializing their anxiety by telling them to stop being anxious. Instead, engage in active dialogue and collaborate on developing strategies to minimize anxiety triggers. 5. Collaborate on coping strategies. Work with your loved one to develop a plan for managing anxiety. Respect their insights and preference, and involve them in decision-making processes. By including them in the planning, you empower them to take an active role in their well-being. 6. Avoid assumptions and ask for their needs. Everyone's experience with anxiety is unique, so it's important not to assume what they need. Instead, ask them about their specific needs and how you can best support them. By seeking their input, you demonstrate respect for their autonomy and individual needs. 7. Validate their fears. Acknowledge and validate your loved one's fears. Understand that their anxiety may stem from genuine concerns, even if they may seem irrational to others. By showing empathy and understanding, you can help alleviate their worries and provide a sense of validation. 8. Offer hope and encouragement. Let your loved one know that anxiety disorders are treatable and that they have the potential to overcome their anxiety. Offer encouragement and support, reminding them of their inner strength and resilience. Recognize and appreciate their efforts in their journey to recover from anxiety. Remember, supporting someone with anxiety requires patience, understanding, and ongoing support. By actively engaging in their well-being and providing a compassionate presence, you can play a significant role in helping them navigate their anxiety and work towards a healthier and more balanced life. How can one go about seeking help and support? If you're experiencing feelings of helplessness, depression, anxiety, or thoughts of self-harm or suicide, don't hesitate to contact your local emergency services immediately for the assistance you need. You can also visit the website Find a Helpline, where you'll find resources such as heartlines and crisis lines specifically dedicated to providing mental health support. You can find links to support resources for suicide and self-harm, as well as eating disorder support for different countries, in the description of this YouTube video. These resources help those who may need assistance in these areas. Remember, you're not alone, and help is available. And there you have it, the critical information about anxiety. If you found this video informative and beneficial, please show your appreciation by giving it a thumbs up and subscribing to our channel. Your support will enable us to reach more people and spread awareness about mental health. Thank you for watching, and stay tuned for our upcoming videos.